Hello, this is Joseph McKellar with Spring Arbor University. Today we're going to be talking about vascular dementia. And what we have to begin with is to understand that our brains are amazing. These organic masterpieces not only direct the functions of our bodies, but they can collect, filter, and save information within their tissues. Now that data, or memories, may be decades old, yet still our brains can make that information available, sort of open it up for us, for retrieval, for us to remember, to be able to see, smell, hear things from our past. Our brains allow us to work with special organs in our bodies to gather information from the environment to make sense of the internal and external world. Yet as finite creatures, our brains cannot remain the same forever. Changes occur with age, sometimes subtle and over time, but for others the changes may occur drastically and quickly. For many people, they expect the brain to change over time and feel that memory loss, judgment difficulties, and behavioral changes are part of getting old. Now, these changes may be classified under the diagnosis of dementia. And although dementia is much more common in older adults than in younger persons, it is not considered a normal part of aging. Dementia in general affects more than 5 million people in the United States. Approximately 60 to 80% of dementia cases are Alzheimer's disease, but the second most common type of dementia is vascular dementia. Vascular dementia is a worldwide disease that affects both men and women, mainly in their older years, but may occur earlier as a result of brain trauma or as a result of out-of-control risk factors. For vascular dementia, our risk factors are diabetes, hypertension, hyperlipidemia or dyslipidemia, smoking, atrial fibrillation, and myocardial infarction. And as we will see, all of those deal with the microvasculature of the brain. Over time, the risk factors like hypertension, diabetes, and hyperlipidemia can cause brain changes. These changes affect the blood vessels in the brain and thus cause brain damage. Hypertension, or high blood pressure, can cause microbleeding in the brain. Diabetes, especially uncontrolled diabetes, can cause microvascular changes in the brain, resulting in hypoperfusion of brain cells and causing cellular death. High lipid counts, especially with triglycerides and LDL cholesterols, cause atherosclerosis, which leads to narrowing of blood vessels, causing hypoperfusion of cells, and leads to cellular death. Vascular lesions develop in the brain, and they may be ischemic, hemorrhagic, or a mixture of both. Those lesions destroy neurons in the brain. The signs and symptoms of vascular dementia typically occur over time and are common among the dementias and Alzheimer's disease. Symptoms like frequent forgetfulness, especially of recent events, difficulty with common tasks like meal preparation, forgetting common words, becoming lost in familiar places, having poor judgment and misplacing objects in unusual places like your clothes in the bathtub, and then changes in mood and or personality from what's normal for the patient, such as irritability. Continuing the clinical presentation, we also have lack of interest or involvement in life activities, as well as small stepped gait, vascular depression, and urge-type urinary continence as signs of advancing vascular dementia. All the symptoms progress at differing rates. The most common assessments for vascular dementia utilize questionnaires. Oral questionnaires like the Mini Mental Status Exam, or MMSE test, involves asking the patient a series of questions to identify and treat dementia in the early stage, before the symptoms are more apparent and when interventions tend to be more successful. The questionnaires are used during routine primary care visits to assist in recognizing possible dementia, since the patient may not be aware of behavioral or judgment changes. In Indonesia, another examination is used for memory function and has been found to improve the accuracy of the overall dementia testing. The Hopkins Verbal Learning Test measures episodic memory. 12 words are said to the patient 3 times, and then after 20 minutes, the patient is asked to recall the 12 words. There are specific diagnostic tools available to help in differentiation of the dementias. Biofluid protein biomarkers have been found to help in the diagnosis of vascular dementia. An elevated CSF serum albumin ratio, for example, has been described in vascular dementia, as well as circulating inflammatory markers such as C-reactive protein and IL-6 are increased in vascular dementia patients compared to both Alzheimer's disease and healthy patients. There are many more other biomarkers being trialed for efficacy in diagnosing vascular dementia. The cases of dementia are not negligible. The number of demented elderly